We learned that for the disadvantages, the primary disadvantages are that there will be limited absorption. Okay, so if the pH and other factors they don't comply, then there can be limited absorption. Then we have learned that over here patient compliance is necessary. You cannot give this drug to a unconscious patient or a semi-conscious, subconscious patient. Then another thing that we have learned, the most important point, that the drugs they do get metabolized over here, and that's pretty bad. So these are and acha, one more point is sometimes you want a rapid action of drug. Okay, you want a faster action of drug, but your stomach is like not empty, it is full. So normally you all have learned that it takes around 3 to 5 years, 3 to 5 hours, not years, 3 to 5 hours for a food to pass down from the stomach to the intestine, which we technically call it as gastric emptying. So yes, gastric emptying. So if you are taking drug along with the food or after the food, then you understand that absorption of the drug will get delayed. So over here, if you are expecting that I'm going to get some rapid action, then that's not going to be possible over here. So these are the few disadvantages of the enteric routes. Now, when we have discussed about this enteric route, over here there is one okay, we can talk about two method over here. Number one method is oral. Okay, in enteric route, first method that I'm going to write, that is oral, and the other one that I'm going to write, that is sublingual. Sublingual. So first let's have some little bit of idea related to this oral drug. So once again, the points that we have learned, basically they're applicable for this oral route. Okay, like they are self-administered. Okay, they have got low risk of infection. We don't need to take care so much. We don't need to take so much precaution over here. Low risk of infection present. Then what are the things we can see in oral route, that over here sometimes somebody has eaten something which was nasty. I mean, a lot of food stuff is also nasty. What I mean by nasty is a person has eaten something which is toxic for the patient. You're not supposed to eat that. Suppose a small child was playing here and there in, how the children are, they have got a normal psychology that they put things in their mouth. So when the thing is going to go to the mouth later on, maybe the parents or somebody has observed this and they understood that it's something which is causing some, which is or which can cause some poisoning, and they get the patient to you. So what you do is you can use some activated charcoal and you can put it in the stomach, and you can go for some lavage technique. Okay, that's washing technique. You can wash and clean the stomach and you can bring it out. But do you think this would have been possible if the entire thing would have gone inside directly through the bloodstream? It wouldn't have been possible, isn't it? So this is one more advantage of taking something orally, that in case of some overdose or in case of some drug toxicities, you can actually have some remedy over here. Okay, so you can always overcome these situations by using something called as antidotes. So antidotes, they help over here a lot. Okay, then there is one more factor that you should remember. Certain drugs, they get absorbed. They are supposed to get absorbed in the intestine. Mostly, we learned that most of the absorption, they do take place in the intestine. I'm not talking about the exceptional cases. Most of them, they are supposed to get absorbed from the intestine. Now imagine I talk about some drug which cannot tolerate acid. Okay, I talk about some drug which cannot tolerate acid. They cannot, these drugs, they break down when you put them in the acidic environment. So if you are giving such drugs via this oral route, do you think they can make their way out till the intestine? No, right? So always remember, like I give you one example of such drug. Have you ever heard of this name? I think you have heard. It's a very common name. It is omeprazole. Even if you haven't studied but you can see a lot of people are taking this, okay, omeprazole. So omeprazole, it's a acid unstable drug. Now, if you want this drug, now what is omeprazole? Omeprazole basically, if you have read last year in your physiology, that there is some cell which is present called as oxyntic cell, and those oxyntic cell, they have got some proton pumps. Technically speaking, proton potassium ATPase pump, which was actually, if you remember the shape of, if you remember this oxyntic cell, it looks somewhat like this, isn't it? If you remember. So over here there was this very beautiful pump present, and this pump, in this canaliculi there was some series of reaction. I'm not going to that detail. This you will be learning in your physiology classes. So over here there was a large amount of potassium concentration present in this area. This area was called as the canaliculi. So in this canaliculi there was a large amount of potassium present, and inside the cell there was a large amount of proton formation taking place with the help of the fastest known enzyme in our body, that's the carbonic anhydrase, if you remember. So this was actually throwing off, it was actually pumping off, you can say, the protons and taking back those potassium. And by some other method of the same, so series of reactions, you will see chloride was going over here, and this proton and chloride, they joined to form HCl. So if I talk about this pump over here, this is utilizing, it is not working automatically, okay, nothing is free in this world. So this is also not working for free. It is also taking, not money, it is also taking ATP. Okay, so by utilizing ATP, this is doing this activity. So this is called as such type of, there are some drugs, okay, there are some drugs which actually block these things. There are some drugs which actually block these things, and they are called as the proton pump. These are proton pumps inhibitors. So omeprazole is a very nice example of proton pump inhibitor, or PPIs. Now, omeprazole is acid unstable drug. Now, if you give this drug will get destroyed in the stomach by the stomach acidity. Such a low pH is present, you know that. So over there, if I want this drug to pass from or to pass through this stomach and then move into the intestine, then you know what I have to do. What I have to do over here is I need to make it I have to make it enteric coated. Correct. So I need to make it enteric coated. So remember, this is one variation which is present in the oral route, that is enteric coated preparation. So enteric coatings protect the drug from the stomach acid, and then they are delivering them into the alkaline intestine. And the property of this coating is, once they are going to reach the alkaline intestine, which is of course less acidic, in such an environment they automatically dissolve out. So once this coating will get dissolved out, after that the thing will get absorbed very easily. So this is something which you need to remember. Once again, suppose I talk about another drug that is called as aspirin. Okay, that's called as aspirin. Aspirin is a severe irritant in our stomach. Later I'm going to tell you that aspirin actually stimulates the release of acid over here. Aspirin is very dangerous for your stomach. Yes. So whenever you are giving aspirin, so over here it's not a matter that whether aspirin will survive or not. Last time the problem was whether omeprazole will survive or not, but over here it's not a question of survival. Over here the problem is aspirin is an irritant to your stomach mucosa, and nobody wants to get irritated. You don't want to irritate your own personal stomach mucosa. So these aspirin, the drug aspirin, this also needs to be coated. This also needs to be coated so that aspirin actually can pass on to the intestine safely. okay, and without irritating the stomach mucosa. So these are the reasons why we have got certain drugs in the market which are entry coated. Then another thing that we are going to talk about, that is this was about the entry coating. This time I'm going to talk about something. So one, we have discussed about enteric coating. Now the next thing that I'm going to discuss, this is about extended release preparation. Extended release preparation.
So extended what?
Release. Extended release preparation. Over here, see, if you have ever read about some drugs, maybe in the contraceptions and all, contraceptive pills and all, in pills it is present, and you can also remember about some extended release preparations. Okay, what happens is you inject or you provide the drug once. Okay, like we are talking orally. So orally you take the pill once, but the drug gets liberated. The drug keeps getting liberated for a longer time. Like if I talk about a drug called as, say, I'll write over here, it's morphine. Okay, morphine.
So morphine.
Morphine. Morphine. Morphine. Have you ever heard of morphine? Morphine, never heard of morphine?
Yes, sir.
Morphine is basically a very dangerous painkiller. A lot of times they keep showing in the movies and all that, when there is a soldier is fighting over there, got some bullet shot and injury and all this stuff, and they take some syringe and they're going to push it in, and the pain gets relieved immediately. So that's morphine. Basically, morphine is opium. Okay, it's an opioid. So there is a god named Morpheus, and it's a god of dreams and all these things. So when you take morphine, you also go into that dreamy land and a very dreamy environment. So that's basically a morphine. Now whenever we suffer from pain, there are two prime ways by which we suffer from pain. Number one, there are some special molecules which are released in our body. Okay, like some types of prostaglandins and also that causes pain. Another thing is, for any such pain sensation, there are some special pathways which you have learnt in last year neuroanatomy. So those pathways, those fibers, they carry the sensation and they put it to your central nervous system. So when we tackle pain, when we talk about painkillers, there are the good term that we use for pain is analgesia. Yes, analgesia. So whenever we talk about painless situation, that's basically analgesia. Correct, analgesics. So when we talk about analgesics, they are of primarily two types. Primarily, as per our discussion right now, they are of two types. Number one, the ones who are going to kill these molecules, the pain causing molecules, they are going to kill it. And the second mechanism is that the pain receptors which are directly present over here, okay, these receptors, they are going to get blocked. Opioid works over here. Okay, opioid works on your central nervous system, and that is why.
So what is the first line of analgesic?
First line, so the category is basically called as a non-steroidal anti-inflammatory drugs, because pain is a part of inflammation. So these drugs which are present, they are basically non-steroidal anti-inflammatory drugs. In short, we call it as NSAID. So yes, NSAID. So basically, in short, we call them as NSAIDs. Okay. So that's one category. So what do? Is they stop the process of inflammation. Like during inflammation, some inflammatory molecules are released, and those inflammatory molecules, they are primarily going to cause the irritation and the pain and all this stuff. So these molecules are working against them. So anti-inflammatory drug. Another one is opioid analgesic. Now when I talk about opioid analgesics, these are the ones who are directly working over here in your central nervous system. So that's morphine. And we will be discussing about all these things eventually as we progress with the syllabus, but it's just like that you should know what we are talking about. Okay, so I'm not going to detail, but I guess I've created a pretty good idea so that you understand what we are talking about. So this is what is morphine. Morphine is basically a pain relieving substance. Morphine is used in case of severe pain when your normal, those I said the non-steroidal drugs, when they cannot treat it. So at that time you use morphine. Now, why am I discussing morphine over here? So remember, if I give somebody morphine, so a morphine needs to be administered almost how many times in a day? 6 times in a day. Why? Because later on in the entire in this session you will learn that one factor which is which controls our dosage, that how many times you are going to give one particular.
The voice is becoming a problem.
Why morphine needs to be given 6 times a day? Because I was telling you that later on in this entire discussion time you will learn that one factor which decides our dosage out of many factors, one such factor is half-life. One such factor is half-life. Half-life decides the our, what do you say, now how many times we are going to give the dose. So over here the half-life of morphine, as of now you can remember, it is 2 to 4 hours. Okay, 2 to 4 hour. I guess from your basic science you have got an idea related to half-life. That means after every 2 to 4 hour, suppose if you have given say 1 kg of morphine, if you have injected 1 kg of morphine,
500.
after 500, then another 2 to 4 hour it will be 250, another 2 to 4 hour 125. So in this way it keeps getting reduced, as over here you have learned that the thing is going to get eliminated. So you see its half-life is 2 to 4 hours, and we have got in a day 24 hours. So 4 6 are 24. So something like that approximate calculation comes up. So you see oral morphine needs to be administered around 6 times within 24 hours to get a continuous analgesic effect. But if you are giving extended release preparation, if you are giving this extended release preparation, then instead of giving these 6 times dose, the dosage is going to get such terrific thing. The dosage gets reduced to only 2 times instead of so many times of this administration. You can just give it 2 times. 2 oral doses are enough. So this is the good effect of extended release preparation. Understood?
So why is it reduced?
Sublingual. Sublingual, how does it help us? Even over here, some people use some term called as buccal root. Buccal root is nothing that you are keeping the drug primarily in the vestibule region. Vestibule part between the gingiva and the cheek mucosa. So, okay, this is the vestibule portion. So, if you are keeping some drug in the vestibule, they are calling it as buccal root, but actually it's the same thing. Okay. So when I talk about this sublingual root, so over here, why do we need some sublingual root, or what advantage? Sublingual, by the name you understand, is beneath the tongue. Okay, beneath the tongue, you are supposed to keep this drug. But question is, why will I keep some drug beneath the tongue suddenly?
Your voice is not clear again.
As that of the parenteral root, but over here this you can give orally. So like I can tell it in this way, that this is such a beautiful root where you enjoy the advantages of the oral root and you also enjoy some of the advantages of the parenteral root. See how? First thing that you need to know is that the mucosa present in the floor of our mouth, it's very thin. It's utterly thin. And beneath the mucosa there is present rich vascularity. And mouth has got super vascularity present, a lot of capillaries present, and mucosa is thin. So first of all, I was telling you that whenever you are giving something via the parenteral route, you have to make sure that it is sterile, it is very clean, and all these things. over here, first of all, you don't need to do this thing. Why? Because you're putting it in the mouth, and your mouth is a part of the gastric system, and it knows how to handle foreign objects. It has got saliva, it has got lysozyme, okay. It has got anything which will be debris, it will be flushed out. Saliva has got flushing effect. In case anything goes inside your stomach, then HCl can handle it. So over here, you do not need to maintain those sterile environment. And that was one advantage which still persists in sublingual route. Now, the next thing is, over here, since the mucosa is very thin, so over here there will be easy absorption. Now, if there is easy absorption, the drug goes directly to the bloodstream. And if the drug goes directly to the bloodstream, now you enjoy all the good things about the parenteral route. That means the drug directly goes to the bloodstream, so it will be rapidly spreading to the body, and after that it will be bypassing those metabolism process by the liver. Okay, so all these advantages which you had about parenteral, you are going to enjoy that now, plus you are going to enjoy the advantage of the oral route. So that is why we sometimes go for sublingual route. You don't need to maintain, this drug over here doesn't need to go through those harsh acidic environment. Okay, so those things are not seen over here. So this is the good thing about sublingual. But one thing you have to remember, there is just one constraint that you have to remember, that is, this drug must pass through the tissues. This drug must pass through the tissues. So if this drug is passing through the tissues, do you think any drug can pass through the tissue? Polar, non-polar, any substance can pass through the membrane? Polar, non-polar, both can easily pass through the membrane. Membrane has got more of what? It is more non-polar substances. Okay, it's more lipidic in nature. So anything which is water soluble, do you think it will easily pass through the membrane? No. For something to pass through the membrane, it is better to have something which is lipid soluble. Okay, so remember that over here,